health facilities or private health facilities to treat the malaria. Presently, in FCT, early this year, on the 18th of March 2025, the flag off ceremony has been done for the distribution of malaria test kit and drugs for free malaria testing and treatment in FCT Public Health Hospital, being implemented by Fancris Health Initiatives. The flagging up was done by the mandate Secretary Health Service and Environment, Dr. Adedaulako Fasowa. So people shall have the confidence to go to the health facilities. The testing and treatment of malaria across the 6 area council in FCT is free. Can we at all age, across all age group. So people shouldn't stay with malaria at their respective residence. As soon as we feel the sign and symptoms, you should move to the nearest public health facilities for testing and treatment is free of charge.
Okay, let me quickly come in here because I can see that you actually pulling through some of the notes you have. But let me quickly ask you, from your own experience, now beyond what you have here on the text, from your own experience, how do you think malaria does actually affect our children? Because I believe you have children, and definitely you must have seen a woman that has pregnancy. How do you think malaria actually affects them?
Actually, children under 5 years of age and pregnant women are the most vulnerable age group to be infected with malaria if remain untreated and if measures have not been taken. So presently in FCT we have several strategies to prevent this age group. Specifically, we have seasonal malaria chemo prevention, that is SMC. Is for healthy children aged 3 to 59 months of age. This medicine is available. It is being distributed and administered by our trained community distributors house to house. We have done, or we have successfully implemented the first cycle in June, the second cycle in July, the third cycle in August, and in the next 48 hours today, that Wednesday, 20 September. So in the next 48 hours by Friday morning, our community drug distributors will be at your residence for free administration of the anti-malaria medicine to eligible children, and the category of the children has to be healthy to administer the drugs. That's for the age group of 3 to 59 months. So we expect our CDDs are well trained and we have achieved a lot of progress. This program has been in the FCT since 2022 and we have successfully done in 2023, 2024, and now we are in 2025. We are presently at the 4th cycle.
Okay, you are presently at the 4th cycle.
Yes.
And you know, if you look at part of what is happening globally for FCT, for instance, now we have they say out of the statistics are in 2024, 4 out of every 10 people are affected by malaria, and 1 in 5 children carry the parasite in their blood. For some time, I've been seeing members of your organization in some of these primary healthcare centers, and also in the local government hospital. For instance, if you go to Kubwa, the general hospital, there you see some of your men there distributing these particular drugs. How is these drugs accessible in some of this pharmacy or maybe in hospital apart from your agent giving out the drugs?
The SMC drugs is not for sale. It is free and is available in all the FCT public health facilities. So we have specific dates for implementation for the drugs administration. So the pattern and the policy for the drugs administration is house to house. So by a trained community drug distributors, popularly known as CDDs. So and if in the institution whereby, based on your question, a situation whereby the caregiver was not able to reach to the CDD, the caregiver can quietly move to the nearest health facilities and indicate that he has the eligible children and has not been administered the medicine. That is it is two combination of medicine we have. We have sulfodozine, fluramidamine, and amiodarone. That is SP and AQ. Sulfodozine stand for SP, then amiodarone AQ put together is known as SPAC. So it's free of charge, it's not for sale, and it's on abuse of service to find any of our SPAC in private pharmacies. And if it is found, we expect that shall be reported to the nearest health facilities or the area council or FCT public health department that SPAC has been sold or found in any pharmacy. The medicine for this seasonal malaria chemoprevention are available in all the FCT, all the public health facilities that meet the criteria for the seasonal malaria chemoprevention intervention. It is supported by malaria consortium. So the medicine is free of charge, is safe, and for prevention.
When you say it is safe, and I'm not seeing it in most of our facilities, probably our health facilities like the pharmacies and the rest of pharmacy, and even some hospitals don't actually dispense such drugs. So that brings to question, because I remember I did ask this question sometime last year about the accessibility of this particular drug. Why is that it is only SMC that do, or your group, the CDD, that actually do give out this drug? Why can't we have them in our hospitals or probably in the pharmacy?
The reason is that the medicine is being supported by Malaria Consortium Philanthropy Fund. So if you are to find the medicine in a pharmacy, it's expected to be for sale and it is free. That's why it shall be found in government facilities and is available. The coverage we have for this year is 98%. The target plan to reach, the target coverage is 98%. So if you go to any community, including the urban cities, there are a series of strategies being adopted to ensure urban cities caregivers, our community drug distributors were able to access the AMAC. You know, there are a series of difficulties we experienced in 2022 when we started the implementation. So we have adopted a series of strategies to ensure the AMAC has been covered. So we have 98% coverage for that eligible age group. So I think it's available. I have confidence that any government health facilities caregiver visited will get it, and they should make inquiry. And we have schedule of activities, and we have all the OICs in the public health facilities have been trained.
What do you mean?
Officer in charge of the primary health care. They have been trained, and if you miss the first cycle, we are now at the fourth cycle. Do you understand? So caregivers has been in the facilities making the inquiry before the time. So we have series of awareness. We have the community leaders awareness, we have the traditional rulers, we have the religious leaders. So announcement has been made in mosques and churches. Do you understand? And in a local community with the traditional rulers outlets. Do you understand? To ensure that the message has reached to the caregivers. So we have high coverage, and the awareness on seasonal malaria prevention in FCT have reached the required target. So it is available at all government health facilities.
So now the SMC or the CDD, based on the term you termed it, which organization or which of the secretariat are they under?
The seasonal malaria chemoprevention is being implemented, as I have seen earlier, by Malaria Consortium, which supports in partnership, in collaboration with Federal Capital Territory Administration, that's Malaria Elimination Program, with the leadership of Federal Ministry of Health, National Malaria Elimination Program.
Okay. Let me quickly move to this. And in terms of if you had the power now to stop malaria before it even touches your child, would you use it? That's the same drugs that you are dispensing in some of these health facilities. If your child is falling sick of malaria, would you still use the same drugs?
Okay, that's very good question. As we have said earlier, there are some criteria for child eligibility. The children that are eligible for SMC, we have two categories. We have children 3 to 12 months. We have children the blister for children 3 to 12 months, and we have the one of the higher blister, that is 12 to 59 months of age. And children that are sick are not eligible for these drugs. They should move to the nearest health facility and get tested. And now, as 2025 is concerned, testing for malaria in FCT is free and treatment is free. So the caregiver should move to the nearest health facility for testing. If the child turn positive, they are expected to be treated at the health facilities. So in the next cycle, if they are healthy, they can then be administered the drugs.
Okay, so that's exactly. So now, in terms of why SMC or SPAC is so important for our children, can you just throw more light on it? How important is this particular group to our children? Because sometimes, even beyond the hospital, you see them within the street trying to mark every household. They must have actually dispensed that drugs.
Yes, the SMC is very important. It's one international intervention and being implemented in FCT. As I've indicated earlier, we begin the implementation in 2022. So the CDDs visited their household across the FCT. We have huge number of CDDs being trained, and they have been in the household early morning of all the days for intervention. We have 4 to 5 days of the intervention. So if they visited the household, they administer the medicine to their eligible children. As soon as they were able to pick up a eligible child at that residence, do you understand? So after administering the medicine, they make a house marking. That house marking serve for several reasons. If one of the criteria for the house marking, if like the CDD team visited the house and the house has like 4 children, based on the explanation of the leaders of the house, you understand, the parent, so and they are not able to cover that 4 children, they are able to reach maybe 2 or 1 of the children, they will indicate in the house marking 2 over 4, so that to say 2 among the 4 children in that residence has been administered. So they have to return back and administer the remaining number of children. These are one of the reasons. Then secondly, we have several supervisors. Do you understand?
Yeah.
Supervising the implementation. We have the area council team moving around the community and the health facility, ensuring the CDDs are active, and if there are any challenges, they sort it out. Okay. We have the state team that is under the national malaria elimination, that is under the FCT malaria elimination program, moving across the area council, supervising, and we have the national team from the Federal Ministry of Health, that's a national malaria elimination program. So we have the smart survey and several reasons. So that house marking is very important. Caregivers shouldn't remove either the sticker in the urban cities. In the towns, most of the time we use the sticker, while in the rural communities we use chalk. Sometimes even in the urban city, in the rural communities, we also use the sticker. So it is served for several reasons.
Okay, so we're going on a very short break because there are several questions that are left yet to be asked, and we'll definitely be needing more from you with respect to the response we get. And just for clarity's sake, the SMC has been there for some time now, and for many of us who do attend the primary health care and maybe let me see, the basic, the general hospitals, you definitely must have come across especially for those who are within that axis of maybe pediatrics, the pregnant women now, or pediatricians. You discover that you see some of these stakeholders in that particular zone in most of our hospitals. So it is important that this information gets out to you, and he has actually given reason why you find it difficult to get these drugs in pharmacy, or maybe being dispensed actually by the hospital. So we'll go on this short break, and when we return, we'll continue with the conversation.
The welfare of millions of people for generations to come may be affected by the wisdom which we here display. If Nigerian leaders and our British partners are to prove themselves worthy of their trust, now is the time for us solemnly and truly to dedicate ourselves to seeking the greatest good of the greatest number of our people in Nigeria. Independence for Nigeria in 1960 is imperative. But independence for Nigeria as a corporate entity is not enough. The peoples of Nigeria must at the same time be guaranteed their freedom. We must ensure that in an independent Nigeria, individual citizens throughout the land enjoy liberty, human dignity, and equality under the law. There must be one Nigeria with one constitution and one law for all. Let us therefore, Mr. Chairman, sir, close our ears to the counsel of despair, which says that we cannot here at this conference agree on a constitution. If there is any doubt among us as to let as the God present,
welcome back from that mouth break, and just before the break, we did raise pertinent question with regards to the essence of the SMC and the CDD that he did mention, and these are actually very important issues for many of us who actually lives in this community where these drugs are being dispensed, and for some of us who have actually visited some of these hospitals, especially when you go close to where they go for their antenatal, I mean the pregnant women, you discover that most of these women are, most of these distributors or dispensers of these particular drugs of malaria actually within that particular axis, and as a result of that, people do raise questions. Sometimes people just collect it and say, I will not use it. So I think that's the more reason why this enlightenment is important. So we have to get to know why they are actually doing this, and how important it is for the children to actually make use of this drug, as the age range is between 3 months, I think, to about 5. And let me come back to you, Madam, sir, Ibrahim. For some time, you know that some say the medicine is too strong for small children, and others say if the child is not sick, why then would you give them medicine? But are these things true or just stories we've heard?
Okay, now the caregivers need to understand how this implementation work. The seasonal malaria chemo prevention SMC is designed for children aged 3 to 59 months. Children below 3 months of age, they have their mother immune, so the medicine is not designed for that age group. While children older than 5 months of age or above 60 months, the medicine is not enough to prevent them from the infection. So so for that, for these two age groups, below 3 are not eligible. We have the SMC criteria, and above 5 months of age are also not eligible for the spark. Then secondly, we have 3 days SMC course. We have the day 1, and it's expected to be DOT, direct observed treatment. The CDD will provide a support to the caregiver on how to administer the spark. And we have I have already indicated earlier, we have 3 spark, the blister for that course. In day 1 is sulfodozine and amiodarone. That is one white and yellow will be administered in day 1. Then there was a questionnaire that the CDD is expected to administer with the caregiver. Will alert and will serve as a reminder to the caregiver to give day 2. Day 2 is in the absence of the CDDs. The caregivers are responsible for their child. The government and the partners always provide a support to ensure that that age group remain healthy and being protected, since they are the vulnerable age group.
Okay.
Then day 3 is also supposed to be given. This full course of treatment would serve as would help the eligible child immune to be very strong. So if they are able to administer day 1, please do not drop the blister. I know the child is already healthy, so definitely the caregiver may forget to give day 2 and day 3. So we urge the caregivers to give day 2 and day 3.
So in this particular case, earlier on you raised the issue of the traditional rulers, and what role do you think traditional rulers and probably community leaders will have to play to see that the implementation or the SMC campaign is a success?
During prior to the implementation, we have done several training on health workers. We have done training with the traditional rulers, and we have done training. We have trained the religious leaders also on how to understand the overview of the seasonal malaria prevention, for them to speak on how to carry out the activities in their respective area of control. So really the traditional rulers provide support at the early stage. Before we begin the implementation, we went for several advocacy, and in several gathering, traditional rulers provide a technical support to speak and make a clarification on how the implementation is to be done. And the religious leaders also, we have done how a church mapping of recent in some of the areas in the FCT. So, and we distributed also letters with the religious leaders to provide announcement in churches and mosques. So apart from the radio presentation, TV appearance presentation, so the traditional rulers provide the technical support, especially where non-compliant zones are. Okay. Especially in the rural communities. Okay. So traditional rulers play a vital role.
So in this particular case that you've mentioned that traditional rulers play a vital role in the implementation of this particular program. Some people have actually said that you've been doing this for some time, and why are there been any major improvement? And if there are major improvements, or probably in some places you still discover that it is difficult to actually say that yes, you people have actually touched.
Of recent, we begin the implementation in 2022. So there was a study that was done that have been carried out. We call it on impact study. It was conducted using a routine data from the health facilities. That is between 2021, the pre-implementation period, and 2022. The effectiveness of the intervention has been demonstrated in FCT since the introduction of the SMC in FCT, and evidenced by 41% reductions in the mean incidence of confirmed malaria cases between the pre-implementation year 2021 and 2022 when the SMC was introduced. So we have 41% reduction in the incidence of malaria between that was based on the survey that was done. The 2021 is there was no SMC in FCT. In 2022 we have the SMC programs. So we have 41% reduction in the incidence of malaria within that age group. So I think it's a great achievement.
That's a very good one, and
yes, it's a good news to the FCT.
It's a very good one because we want to see that yes, there is improvement in terms of our health, especially those of our children that are just coming up, and a very good one that you guys are actually targeting between the children between the 3 months to 59 months, which will actually probably help them to live longer. In order for us to be able to have access to this particular intervention, most of our primary health centers and also the primary institution in terms of health, that's local government health facilities, you can always have access to most of the distributors of this particular drugs, most especially when you go to the unit for the antenatal unit. I think mainly you see them there trying as much as possible to educate those who should be able to take the drug. So this is how far we can go today on the program, the afternoon edition. Our discussion has been centered on encouraging listeners to avail their children to receive the SMC when CDDs visit the household or visit health centers when children are ill, and also to actually look at some of the other issues that are very, very important. You can actually seek for more explanation when you meet with one or two of their agents in some of these places. This is how far we can go today on the afternoon edition. My name is Isa. No, have a wonderful day and stay blessed.
Manifestos, common dangers and common enemies alert us on the need